Hi, my name is Jeanette McWilliams, and I'm the Administrative Director for the MGH Chelsea Healthcare Center. We are part of the Massachusetts General Hospital, so we are pleased to bring to the community the excellent services provided by the Massachusetts General Hospital. Services include primary care for both adults and for children. We also have some specialty services available, and for those specialty services that we do not provide at the health center, they are provided at the Mass General, and we have a free shuttle bus that will take patients there. We also have programs to keep you healthy in a number of our practices throughout the health center. I'd like to encourage folks, when you come to the health center, we do not have on some days adequate parking, so a reminder to please feel free to use our free valet parking service that you can drop your car off at the front entrance to the health center and have a valet park your car for you. This is Millie Escobar, and Millie works in patient financial services here at the health center, and she's going to provide you with some information about registration and patient financial services.
Good morning. My name is, as Jeanette said, Millie Escobar, and I work here at the MGH in Chelsea. I've been here for 25 years, and this is patient financial services / registration / charge entry. This is one of the first places that a patient would come when they visit the MGH Chelsea Health Center. One of the central places, because this is where the patient would furnish the most important information as far as insurance coverage, address, contact information, and most of all, insurance information when it comes to applying or furnishing information such as medical coverage. This is also one of the central places where patients would come in when they need information as to what type of coverage they would be eligible for, or what type of coverage they would qualify for, or how to be able to navigate the system as to what the state has to offer to them, and how to be able to apply for all those services.
Thank you, Millie. Here in urgent care with Diana Ploss, charge nurse, and she's going to talk a little bit with you about the role of urgent care in the health center.
Hi, how you doing? Hi. The urgent care department here at Chelsea MGH is not an emergency room. Although we do see some complicated patients here who we end up transferring to other hospitals for further care. So we're staffed with physicians, nurse practitioners, nurses, we have MAs, we have interpreters. So patients walk through our doors complaining of anything from a cough or a sore throat or chest pain. And then we basically either take care of their needs here, whether it be they get a prescription or if they require further medical attention, they end up going to one of the outlying hospitals, Mass General or the Whidden.
Okay, and your hours?
We're open 7 days a week. Monday through Friday, we're open 7 a.m. to 10 p.m. If patients check in up to 10 p.m., we still see them, so we may be here as late as 12 or 1 in the morning. On the weekends, we're open from 7 a.m. to 7 p.m., again with the full staff of people. Nurses, nurse practitioners, and physicians.
And you're also, that includes holidays as well?
Yes, we're open every holiday. So we're open 365 days a year.
Correct.
Yeah.
Rain or shine, snow, doesn't matter.
Rain or shine, snow, doesn't matter, we're here.
They're always here.
Yes.
Okay, great.
Thank you,
Diana.
Thank you a lot.
Okay, we're still on the first floor of the health center, and we're currently in the waiting area and reception area for our laboratory and radiology, or known as X-ray. I have here two members of our laboratory staff that are going to tell you about the lab and its services.
Hi, good morning. My name is Maria Bishop, and this is Davina Arredondo. We work in the lab downstairs here. It's a satellite facility. We do about 300 samples a day we process. We have a great rapport with the physicians and nurses and staff here, and it's very convenient. The urgent care is right outside here. So if there is an emergency, we can process the bloods right away and get the results, to the doctors right away. We're conveniently located in Chelsea. We have a bilingual staff, which is very accommodating, and for the patients, they feel at ease that way in case there is a communication problem. Our hours, we basically open at 8 in the morning, and we're open till 8 at night. On Fridays, we close at 5 o'clock. We're a satellite facility. We also get our specimens from Everett and Revere, so it's great that our samples can go to Boston. If we don't process the test here, we will send it to Boston right away, and that's about it. And I'm going to turn it over to Davina, and she will translate in Spanish.
Buenos días, mi nombre es Divina Redondo, es María Bishop. Yo soy una de las tecnólogas aquí en el laboratorio. Nuestras horas de operación son de lunes a jueves de 8 de la mañana a 8 de la noche y los viernes de 8 de la mañana a 5 de la tarde. Sábado nosotros abrimos a las 8 de la mañana hasta las 12 del día. Nosotros somos, a pesar de que somos un centro que es pequeño, nuestra operación es un poco compleja por la diversidad de test que nosotros hacemos aquí, y además porque nosotros aceptamos muestras y especímenes de diferentes sitios como Riviera, Everett. Nosotros también tenemos un cuarto de emergencia en el cual hacemos las pruebas de laboratorio y los pacientes pueden venir aquí durante todos los días. Nuestro laboratorio es un poco pequeño, pero es bien complejo y tenemos una diversidad de multicultural. Hablamos diferentes idiomas, además del inglés, como el español, el francés, hay italiano y árabe. Nosotros, a pesar de que somos un sitio que es pequeño, también nosotros aportamos a la comunidad un importante servicio porque es muy conveniente para pacientes que vienen de diferentes zonas, no tener que llegar hasta Boston a hacer las pruebas, pues nosotros le proveemos los servicios. Además, nuestro personal es bien capacitado y tenemos una muy buena relación con los doctores y con las enfermeras y con todo el staff de aquí de Chelsea. Muchísimas gracias.
We have a great phlebotomy staff here who are very accommodating for young children and adults, so thank you very much.
Here we are in radiology, or known to many patients as the X-ray department, and I have John Sheehan, who's the manager here in the X-ray department, and he's going to talk about our X-ray services here at the health center.
Thank you. Our X-ray department has one X-ray room and 2 ultrasound rooms. So in this area, we do those exams. We do patients from the health centers. Patients from outside can come here, and we also X-ray patients from Boston. And we do get mixed up with the imaging center across the street, which is also MGH. We're at 151 Everett Ave. The imaging center is at 80 Everett Ave, and they do CT and MR and PET CT over there. So if you'd like to go into one of the X-ray rooms, I'll take you into there. X-ray rooms here. This is the latest and the best. It's all digital. There's no film that's used here. The images they're all computerized, and they are sent to Boston where they're read. And also in this department, we have the ultrasound rooms, and there's one over here that's open. And in here, they'll do all types of ultrasounds. We'll do just about everything that the hospital does. We don't do invasive procedures or interventional procedures, but we'll do abdominal ultrasounds, pelvic ultrasounds, whatever your doctor orders. One of the things that when you're coming here, you have to make sure that you have a doctor's request. You can't just walk in and expect to be seen. So if you come in, you'll need that request from the doctor. That's for all of our exams. Our ultrasounds are scheduled, usually the day before, but all other exams, the patients, they usually walk in and we'll take care of them right away.
I'm in the medical specialties area on the first floor of the health center. I have two members of the specialty staff that have joined me here to talk about the medical specialties unit. So I'm going to let them introduce themselves and tell you a little bit about medical specialties.
Hello, my name is Sandra Lozada. I work in the medical specialties area. We're basically a department that has a bunch of providers, which we do neurology, urology, nutrition, GYN. So we have a little bit of everything where we specialize in those certain areas for our patients. There's more information to talk about, so I'll pass it on to my coworker, Jackie.
Hi, my name is Jackie. Right here at Medical Specialties, we offer different, specialists. We have the GID clinic, STD, which is Tuesdays and Thursdays. We also have this program for the patients with diabetes. We do a renal screening that a provider comes from the Mass Pioneer. We have also rheumatology. So we have a couple of different specialists here, but for patients to come here, we usually get referrals from adult medicine. We get referrals from the MGH of Revere, MGH Everett, Charlestown. So we get patients from every community to come here, but they have to be referred, and we provide the best quality care right here in MGH Chelsea. So basically, we also work closely with urgent care. And we work closely with the doctors in here, to get the best communications between patients and providers. So we do the best here.
Do your providers use the electronic medical records so that if I come here as a patient, you're not depending on a piece of paper to come to tell you why I'm coming to see your specialist, so that if my medical record has to be somewhere else? Now that we're electronic, does that make it easier for the specialist?
Yeah, well, actually, we see MGH patients. And if a patient is being referred out of the network, we have to get all the medical records from that patient. But if it's through an MGH, we have all the information, so it makes it easier.
Great.
That's why we book appointments ahead of time for patients, so we have all the information once they come here.
Bueno, nosotros estamos localizados en el MGH de Chelsea. Somos el departamento de medicinas especialistas. Especializamos muchos en diferentes departamentos que tenemos para nuestros pacientes aquí. Aquí te paso mi compañera Jackie, que te puede decir un poquito más del departamento de nosotros.
Aquí trabajamos con el departamento de nutrición, reumatología, ginecología, urología, podiatría. Tenemos servicios para los pacientes que tienen diabetes de la retina. Ofrecemos un servicio que le toman fotografía de los ojos. Tenemos también una clínica que es gratis para la comunidad de enfermedades sexualmente transmitidas, que son los martes y los jueves. Los pacientes que vienen aquí siempre son referidos de un doctor primario. Son algunos del MGH de Revere, del Charlestown, de Everett, y vienen aquí porque un doctor los refirió. Y si un paciente es fuera del hospital de MGH, tenemos que tener los documentos de ese paciente antes que vengan a la cita. Y le damos todo el servicio que podemos, lo mejor que podemos aquí para los pacientes. Gracias.
We're going up to the second floor of the health center. You don't have to take the stairway. There are elevators available. And on the second floor are our two primary care practices for adults and children, as well as our obstetrics department. So let's go on up to the second floor. So now we're in the obstetrics prenatal department on the second floor of the health center, and I have two members of our staff here. I'll let them introduce themselves and say a few words about their unit.
My name is Sheila Rodriguez, and I'm the practice manager here in the obstetrics department and gynecology at the Chelsea Health Center. We provide a variety of services to our patients. We have a lot of low-income patients that come in, and we provide them great health care here. We have midwives, we have OBGYN physicians that come in to help our patients, and we do a lot of family planning services as well.
Mi nombre es Elisa Reyes, soy una de las medical assistant. Me siento bien contenta de trabajar aquí en Chelsea. Chelsea es una de las comunidades más hermosas y más superpoblada en el aspecto de pacientes, donde tenemos diferentes clases de pacientes de todas las áreas, de todos los lenguajes. Tenemos aquí un equipo de parteras muy especiales, donde le dan un cariño y un trato a todos los pacientes. Igualmente tenemos la doctora Pechet, tenemos a la doctora Henley, tenemos especialistas en medicina, fetal medicine, y realmente Chelsea es uno de los sitios donde yo creo que se le da el mejor trato, el mejor servicio, se le da mucho cariño a los pacientes, se trata con respeto, y Chelsea, créeme, es una comunidad hermosa donde tenemos mucho potencial para ofrecerle a nuestra comunidad.
Adult medicine on the second floor of the health center, and I have here with me Laurie O'Leary, and she's a nurse practitioner in our adult medicine practice, and she's going to talk a little bit about adult medicine.
Our adult medicine practice is one of the largest practices of our health center, and we actually function as a team. So as we welcome our patients into the waiting room through the secretaries. The medical assistants will bring our patients into the room and get them prepared, and we have a team of nurse practitioners and physicians that give ongoing care for many chronic illnesses such as diabetes, heart disease, high blood pressure, or general adult care like physicals and screening tests. We're open evenings and Saturday mornings. We offer services to residents of the area as well as many cultures, so that if we have patients speaking languages other than English, such as Spanish, Somalian, Vietnamese, Haitian, we have interpreter services available to make the visit as efficient and meaningful to the patient as possible. A lot of our patients have been with us for many years and identified their doctor and their nurse practitioner almost as part of the family. We frequently see many of the family members and get referred the sisters and the brothers. So we feel like we're a good part of the Chelsea community.
Great. What if I'm a patient of yours and it's a Saturday morning and I don't feel well? Is there an on-call physician that I could get in touch with?
There is always an on-call physician, nights, weekends. And if, in talking with the physician, if he or she feels that it's something more urgent than being seen in next week, they will refer you either to urgent care downstairs, or if it's critical, they will say, call 911 now and go into the hospital. So it's triage through the on-call physician.
And what about if I don't have an appointment, or can I be seen anyway if I don't feel well on a day during the week during business hours?
One of our strengths that I forgot to mention is our triage nurse staff here. We have 4 nurses who triage. So yes, you walk in feeling not well, you will see one of our nurses who will either take care of your problem or get you seen. Either that day, if we're full, then you get referred down to our urgent care again. If not, you can be seen within the 24 to 48 hours for urgent visits.
Okay. Thank you very much, Laurie.
Thank you.
I'm here with Kathy Healy. She's a nurse practitioner here in our adolescent pediatric unit in the health center, and she's going to describe the activities and staffing of her unit for us.
Thank you. So just to let you know that this practice has been in existence for over 30 years. We've been a standard of healthcare here in the Chelsea community for taking care of children and adolescents, babies from birth through age 22. Our services that we provide are with both pediatricians and with nurse practitioners. We have currently 10 pediatricians on staff. We also are a teaching hospital, so that we provide services with medical residents and pediatric residents. So we have a full service that we're offering to all the clients and families of Chelsea. Our hours are from 8:30 in the morning until 9 o'clock on Monday through Thursday, and on Friday we're open from 8 o'clock until 5, and on Saturday we're open from 8:30 until 12 noon. We provide services, health care to all children with chronic illnesses, children who are healthy and well, who need their immunizations. We provide chronic care for children who have chronic illnesses. We do a lot of care for children with asthma, and we take care of the multiply handicapped child also. We work together with specialists at Mass General Hospital for Children, and we are so happy to be within this community and working here with all the families in Chelsea. One of the nice services that we provide is that our families can call at any time, and they can get appointments the same day for children that are ill most of the time, and we also have very easy access for children who need physicals to go to school. We also have doctors who are on call, who visit the babies and the sick children in the hospital. They're on call 7 days a week, and we provide that service. And we also have a telephone triage service, so that families who are calling just to have questions about their children, they can call, and they'll get the answers by a qualified nurse triage service.
Hey, I'm here in the WIC department, which is on the 3rd floor of the health center. We have an excellent WIC department here, and I have 2 members of the staff that will introduce themselves and talk a little bit about our WIC program.
Good morning. My name is Carol Breed. I'm the director of the program, and this is Gisabel Orta. She is the community coordinator. She goes out into the community and informs all of the people in many different languages about the WIC program in our services. And I wanted to tell you this morning about our WIC program. It stands for Women, Infants, and Children. It's a supplemental food program. It's been around for over 30 years in the United States, and it's helped a lot of families. The people who we serve on WIC are pregnant women, new moms and infants, and children up to the age of 5. There are 3 components of the WIC program. Number 1 is nutrition counseling. And that is where we have nutritionists who are trained to counsel moms and children and the moms on their infants on how what types of food they should be eating. They talk about how to save money. They talk about the best way to feed your infant is breastfeeding. And they offer all kinds of advice. And of course, the parents can ask any question they want, and we prefer that the questions come from the moms, and so that we can answer the kinds of questions that they may have to help them in their everyday life, taking care of their families. The other thing that WIC offers are referrals. There are agencies in the community that are there to help families, and we refer, such as fuel assistance. That would be one of the referrals we give. There are a number of other referrals with families who may want to go to Head Start. But there are a number of other ones that Gisabel can tell you a little bit more about. And of course, one big thing that we do is we give out checks for foods, and the foods are specific. It's milk and peanut butter, dried beans, eggs, 100% fruit juice, cereals that are low in sugar and high in iron, and we have eggs and cheese. The one thing that I'm really excited about is that we will be offering a new food package soon, and I'll tell you a little bit more about that later. Their checks can be redeemed at Stop and Shop, Shaw's, and many of the mom and pop stores that work with our program. And now Gisabel will talk to you about the requirements for the program.
Okay, so to be eligible to receive WIC services, you have to live in Massachusetts, have a child under the age of 5. your family income guidelines needs to meet the income guidelines established by WIC. And I'm going to just give you an example. A family of 4 can make up to $39,220 a year, which is about $755 a week. And be eligible to receive WIC services. Just to remind you that a pregnant woman counts as 2 in a household, so that's helpful. And I'm just going to talk a little bit more about the referral services. When families come in to receive WIC services, one of the components is the referral service, which the nutritionist refer them to different agencies in the community, such as fuel assistance, food stamps, housing, daycare programs, adult education programs, unemployment agencies. It's a variety of services that nutritionists are prepared to refer families to.
The other very important piece of WIC is getting prenatal women on the program early. So we want to say out there for all of you prenatal women, as soon as you find out that you are pregnant, you can come into WIC. There is no insurance. We don't require insurance. You can come to us before you see the doctor. If you don't have a doctor or insurance, we will refer you to a doctor and we'll help you gain access to insurance. But that is extremely important, and that's because the sooner you get on WIC, the sooner you get the services, the nutrition counseling, and the foods, and that's how your baby grows to be nice and healthy. So don't delay. We really hope you come soon, and we want to help you have a healthy baby. One other piece of this is we have a new food package coming, as I mentioned, and the new food package will be much more in line with proper nutrition, decreasing some of the fats such as cholesterol and that sort of thing. It will be whole grains, there'll be fresh fruits and vegetables, there'll be fruit juice, but not for a child, not until a child is 1 year old, which the pediatricians are I'm sure they'll be happy about. There are many other foods, corn tortillas, whole grain bread, whole grain cereals that are much better for the to offer variety now. We have more variety than there used to be. But more will be coming out about our new food package, and we hope that that will also help the families be more excited about the WIC program, because now we have a better selection, and it's also ethnically appropriate. The other piece that we wanted to discuss today was the Mother-to-Mother program. This is a program where we have moms who breastfed their babies who are now working in the program to help support moms who breastfeed. This is extremely important so that moms can continue breastfeeding their babies. We're hoping for a full year. This is great for the baby, it's great for the mom, it really does build high self-esteem, and we are very happy that we can now offer that service. Thank you very much for your time today, and we hope we've been helpful.
Okay, I'm sitting with Sarah Wu. Sarah is the Director of Community Health Programs here at the Chelsea Health Center, and she's going to talk for a few minutes about the staffing and the services offered here through the use of the community health team members.
Good morning, everyone. Thank you for your time. The community health team, what we do in the community health team is we try and create an interface between the community and the clinical practices. So anything that the providers are unable to do in their sessions because they've run out of time or they don't have enough time to fully take care of a patient's need, we try and fill in and provide services so that patients get comprehensive health care. So we provide not only interpreter services, but follow-up patient navigation services. We work with disadvantaged patients. If there's disparities in health care, we try and work on reducing those disparities. We work on specific issues around refugee and immigrant health issues. We work on women who are struggling with parenting. We have a lot of programs around disease management for specific issues. So we have a cancer programming around breast cancer, cervical cancer, colon cancer, diabetes programming, and like I said, special refugee programming, hunger services, all those kind of, the things that are not traditionally, that would not traditionally be covered in a clinical appointment, we're trying to cover here in the community health team.
Good. Any programs for domestic violence?
There are programs for domestic violence, for children who've witnessed violence, and also to prevent child abuse and neglect. We do have programs around those as well.
Great. What about interpreters? Can you sample of some of the languages that we cover?
So we cover Spanish, Portuguese, Haitian Creole, French, Bosnian. You're going to have to help me remember. Arabic, Dari, which is the language of Afghanistan. What am I missing?
Sounds like all of it. We don't need to get that
Somali,
part in.
Somali, and Mai are the. So yes, we have quite a bit of language services here.
Okay. I'm at physical therapy now, which is also on the third floor of the health center, and I'm joined by Marie Brownrigg, who's one of our staff physical therapists, to talk a little bit about our physical therapy services.
Okay. Well, physical therapy services, we offer people, we help them get better after they've had an injury or surgery or a stroke. We also do a lot of education on how to prevent back injury. We try to go out into the communities to teach about fall prevention and prevention of back injury. And we see all ages of people, we see little ones up to, we see many elders who are well into their 80s. Most of those people are for fall prevention. And that's really about it.
Do patients need a referral from a physician to receive services here?
Yes, patients would need a written physician's order to be seen here. We see folks by referral from physicians here at the health center and also physicians who are off-site.
Okay. Okay. What about anybody who's being followed up from a work-related injury?
We will see people who have been injured at work. We see a lot of folks for that, mainly a lot of back injuries happen at work, or a lot of repetitive injuries. So we gladly will see those folks.
And how many therapists do you have on staff?
Right now we have 5 therapists on staff, 2 full-time, and the rest are part-time.
I'm going to go to medical records department here in the health center, and medical records no longer carries or stores or files all the paper that we have in the past. We are mostly electronic, so we have a much smaller medical records department than we have in the past. One of the functions that we provide, our service we provide to our patients, is if you need copies of your medical record information to go to another physician, or if you're relocating out of the area, if you need copies of your children's health records for camp or for school, for their immunizations. We have staff here that can provide that service for you, and that's where we're going to go now. Records correspondence area, and I have 2 of the medical records staff, and I'll let them introduce themselves and talk a little bit about what we do here in medical records correspondence.
My name is Donna Proudfit. I'm a correspondence secretary. We abstract records for attorneys, other facilities, and also we help the local people come and get their children's physicals and their shots, and require IDs for that because of the HIPAA law, which states that we have to make sure that their privacy is kept private, and I think we do a really great job at that.
We do. Great. Thank you. Thank you, Donna.
Hi, my name is Sharon Checker, and I also work in the medical records department as a correspondence secretary. And I'll reiterate what Donna has said. We provide a service of medical records for the patients who come in and need them for multiple reasons. Attorneys, insurance reasons, school. I'd like to let the parents know for the school and camp that they should come in 24 to 48 hours prior to needing those records, so they ensure that they do have them for the school and for camp. And one of our most important services is providing complete confidentiality for the patient, and we do that with the utmost respect. We do ask for ID, which can be a passport, anything with the picture ID that's legalized by the state.
What's the average turnaround time if I come to request information? Is it a day, 2 days, a week?
For camp and for school, it's 24 to 48 hours, and for other regular requests, it's 5 to 10 working days.
And other than ID, is there anything somebody needs to provide when they come to retrieve any of the record information?
No, just usually their picture ID and their blue card we ask for. If they don't have the blue card, it's okay, as long as they have a picture ID of themselves.
Anything else? Okay, great. Thank you for your time. Okay, I'm now in the speech, language, and reading disabilities unit in the health center, and I'm with Carol Dennis, and I'll let her talk a little bit about who she is and what services are offered here in the speech department.
Hello, my name is Carol Dennis, and I'm the clinical director for the speech, language, and reading unit here at MGH in Chelsea, and also the unit we have in Revere. On site here, we have 7 speech language pathologists, 4 people who are bilingual in Spanish, 1 person also trilingual in Portuguese, and we have 1 full-time support staff person. We offer a variety of services for speech and language problems that range from pronunciation and stuttering to grammar and sentence structure problems, reading problems that affect kids' ability to actually read the words and to understand what they read. We will take referrals from almost any source. We typically need a doctor's referral, but if a parent calls in, we can try to connect with their physician to secure a referral as appropriate. Our initial appointments are evaluations to figure out what the problem may or may not be, and those appointments usually last about anywhere from an hour to 4 hours in length. Then we then write up a big long report explaining all the details and recommendations. And if therapy is recommended, you'd come back here for sessions typically once or twice weekly. Sessions are usually 45 minutes. We invite parents or significant others to observe our sessions either in the room, or we have video and audio monitoring they can watch from adjacent rooms. We really like participation so we can help people know what we do and how to best help their family members improve their communication skills. Thank you.
Okay, I'm now in the Mental Health and Social Service Department in the Health Center on the 4th floor. I'm with Mary Lyons Hunter, and she's the director of the unit, and I'm going to let her talk a little bit about who she is, what she does, and what services are offered here in this department.
Thanks, Jeanette. Hi, my name is Dr. Mary Lyons Hunter, and I'm a psychologist as well as the unit chief of the Mental Health Department. Our department is comprised of a large multidisciplinary team, and we provide many services such as psychopharmacology, psychotherapy, concrete service assistance for folks that might need help with housing or issues with food or identifying food banks. Our staff is comprised of psychiatrists, social workers, psychologists, resource specialists, as well as an administrative staff that will help with insurance approval, et cetera. Our unit takes most health insurances, and most health insurances cover mental health services. We do provide services to patients of the health center, and we do request that you would get a referral from your primary care doctor for services in the mental health department. The types of services range, as I said, from psychotherapy to medication to help with concrete services. And many of our patients have either major mental illness or issues with depression or anxiety. Sometimes people feel like they just need a little bit of help to get through a particular stressor in their daily life, or something that's happened to them recently, maybe a recent loss, that we can be of assistance to them. We provide services for children, adolescents, adults, as well as geriatric population. So we cover from anyone that would really be seen in the health center can be also seen in mental health. If you find yourself that you need an emergency assessment, or you're having a particular crisis, obviously during working hours you may contact us. After hours, we suggest you go to your nearest emergency room. We do not have an after hours emergency room here for mental health care, but they do have one at the Whidden, they have it in Boston, at Mass General, and all of the other major hospitals in the area through their emergency room can assist you. For urgent issues during working hours, we're more than happy to have you come in and speak to us or contact us via phone.
Okay. Hi, my name is Jeanette McWilliams, and I'm the Administrative Director for the MGH Chelsea Healthcare Center. We are part of the Massachusetts General Hospital, so we are pleased to bring to the community the excellent services provided by the Massachusetts General Hospital. If at any time during your care here at the health center, please feel free to stop by administration, my office here on the 4th floor, and if you'd like to share any information, follow-up, or feedback for us, either talk with myself or a member of my staff, we'll be happy to have that conversation with you. We want to know when things go really, really well here, which they always do, but occasionally there might be something that just doesn't quite feel right to you, and I want to please encourage you to come by and talk to us about that so we can follow up.
Hi, my name is Sheila Arsenault, and I am the nurse manager and triage nurse here at the 100 Everett Avenue site at the Chelsea Health Center. We, at 100 Everett Ave, we are a satellite of the adult medicine practice, which is also at 151. At this site, we have 6 physicians, a nurse practitioner who is also a diabetes educator, 3 RNs, an RN case manager, 2 LPNs, and we have our own laboratory on site. We offer the same services as the 151 Everett Ave location, and we have started a diabetes initiative at both sites with primarily a lot of the patients being seen here, as well as at 151, where we're running classes in both English and Spanish. We have 1 full-time diabetes educator, and we have a 2nd RN who will be sitting for his boards to become a certified diabetes educator. We have been at this site it'll be 14 years in July. We do offer all the same services as adult medicine does across the street, not on site here at 100, but at 151. So we will offer neurology, urology, nutrition, physical therapy, any of the services that you can get in adult medicine at 151, you'll be able to get the same services at adult medicine at 100 Everett Avenue. We are not open in the evenings. We are only open till 4:30 in the afternoon, Monday through Friday, and we're closed on weekends.
Hi, welcome to the Student Health Center at Chelsea High School. My name is Jordan Hampton. I'm a pediatric nurse practitioner here. I work for MGH Chelsea, and this is a satellite clinic of MGH Chelsea Adolescent and Pediatric Medicine Unit. The Student Health Center has been open here in the high school for almost 20 years. We have full primary care services. I'm a pediatric nurse practitioner. I'm able to do full primary care. In addition, we offer full mental health services as well. We're open Monday through Friday from 8 to 4 in the nurse's office health center area of the high school. And our services are available for all the students at Chelsea High School, whether or not they're a patient at MGH. The services are free for students and confidential. I have a wonderful assistant, Claudia, who works here with me. And we're here during school hours and closed during school vacation time. The full range of services that we provide here includes primary care, which would incorporate physical exams, including sports physicals, and sick visits. For example, many times students are referred to me by the school nurse. If a student comes to the school nurse's office with a sore throat, she might feel that the sore throat is possibly strep throat. Instead of leaving the school and going to the regular doctor's office to be tested for strep throat, I can do lab tests here. For strep throat, I can also write a prescription for medication to treat the strep throat. This enables the students to stay in school. It enables parents to not miss time from work. Often it's easier and faster to get an appointment here at the Student Health Center than it would be at the regular clinic. We collaborate a lot with the regular physicians, especially those at MGH Chelsea. We also run several after-school programs, including Stay in Shape, which is a nutrition and exercise program for girls each semester. We work with MGH Chelsea with the Jobs for Youth program during the summer and interview students who will be hired by MGH Chelsea for summer internships. We also work very closely with the school and do several extra programs, things like an annual blood drive and free prom dress giveaways for the juniors and senior girls who are looking for dresses for their proms. We do provide full mental health services here on site. Teresa Grignon is our mental health provider, and we would take referrals from the school and from the primary care providers and also from my office. Another thing that we work hard to do here at Chelsea High School is to prevent teen pregnancy. One of the ways that we do that is that we have a teen parent support group that we run. Teresa and I run that together, and we refer girls to the Circle of Care program over at Roca.
And, you know, all the students are free to use the mental health services here. They can be dealing with depression, issues with parents, siblings, maybe relationship problems. But anything that helps them to feel better will free up their energy to produce better in the classroom, and that's another reason why we're here. So, and many kids take advantage of the service, believe it or not. So we're lucky we have this office supported by the hospital.
Hi, my name is Dr. Lisa Carr. I'm the medical director of the MGH Roca Youth Health Center. We've been here for over 10 years. We see young people aged 14 to 24 for a whole variety of things. We especially do talk to young people about birth control options, about sexually transmitted diseases and how to prevent and treat these. We also talk to young people about relationships and help them if they're having any difficulties in their relationships or experiencing any relationship violence. We're affiliated with the MGH Chelsea Healthcare Center, part of their pediatric unit. We also have a close relationship with the Student Health Center at the Chelsea High School. And people can come in. We're open Tuesdays and Thursday evenings from 5:30 to 8, and we're hoping to expand hours on Tuesday afternoons as well. People under 19 do not need to worry about insurance. They can come in and we will help them with that. People who are between 19 and 24, we are happy to talk to them about any kind of insurance issues, and we'll help them apply for insurance if they need that. We speak both English and Spanish. Our staff includes 2 nurse practitioners, Gail Gall and Janet Moses, myself, and Vicky Segovia, who is a family practice counselor and outreach worker. To make an appointment, you just walk in during our hours and sign up, and we will see anybody who has signed up before 7:30. And if you've been here before, you can then sign up for an appointment in the future as well. Thank you.